Okay, so this is part one of the methods of assessment, and this is we'll introduce the concept of direct versus indirect, and we're going to spend most of our time talking about anthropometrics. And then our next lecture, we'll talk about more of the assessments for the body composition. So real quick, all the assessments that we're going to be doing are going to be indirect, because the direct assessment, in order to do this, you basically would have to physically dissect all the fat, measure it, weigh it, and then now you know how much of your tissues were fat and how much were lean body mass. Some might applaud that and say, hey, it's like liposuction, but you're not going to get 0% fat, and it's pretty invasive. This is sometimes done chemically through as another aspect, but again, it results in destruction of the tissue. So most of the assessments are going to be indirect, meaning that we're going to introduce a standard error of estimate, meaning that you'll never, ever, ever, ever have a true accurate measure of your body composition. It will always be some level plus or minus 3%, plus or minus 8%, plus or minus, right? And what we try to do is try to get as specific as possible. But what we're really looking for in fitness is consistency over time. So especially when we talk about body composition and these indirect assessments, particularly the skin fold and the girth measurements that we're going to be doing, I don't care that we're accurate. I don't care that we get 12%, but you're really 15%. What I really care is that in a month, we went from 12%, aka 15%, to 10% or 13%. And in the end, it doesn't matter because I'm just more interested in that difference. So those are all the indirect assessments. Some of them are really expensive and some of them are super easy. We'll talk about some of them, and we're going to do 3 or 4 of them in lab. Okay, so anthropometry is a part of anthropology that basically just looks at like stature, height, body measurements, and it is the single most portable, universally applicable, inexpensive, and non-invasive technique for assessing size, proportions, and composition of the human body. It's not entirely accurate, but it's quick and easy. And you'll see, I'm sure every time you go into the doctor, they look for your height and weight, and then they're calculating your BMI. If you're not familiar with that, we'll talk about it in a couple slides. And you probably have had some circumference measurements taken in the past, mostly in the waist or the hip area. But it can be used to predict body composition, but it's highly inaccurate, and it still is about as effective as a scale at telling you how fat you are in some instances. So height stature measurement, you've seen this device on the right where you stand on it and it measures you. These are like the high-tech ones that look like they shoot some lasers in you or something. I don't know. But you basically your height, right? And your feet are flat, you're looking straight ahead, and you're measuring your height. And then you all are familiar with the scale, and you step on the scale. This has an integrated scale on it, and it tells you how much you weigh. Now, that is the basis for the BMI, this body mass index. And it's nothing more than a tabulated height, weight chart that's just an index scale. And it takes you through and it kind of shows, you look at your weight at the bottom, the height at the bottom and weight, and then you look up and you see where you fall on the chart. So these numbers are all over the place. And like for me, for instance, I am 5'9", and I float between 190 and 200 pounds. So that puts me at like a 28 to 30, which 30 is considered obese, clinically obese. Now you have obesity, you have mild, moderate, and then you have morbid obesity, more severe. But you can see that the green and the tan areas, these are the areas that you want to be in. But yeah, I float between here and there. Now, here's my problem with BMI is that in order for me to be in the quote unquote healthy range, I'm also about 20% body fat, and I float between 18% and 24%. In order for me to get down to my weight that I need, I would actually need to start to lose not just body fat, but lean body mass. And that is a no way Jose situation. So here you can visually see the scales there, and anything over 30 is considered obese. It doesn't matter for men or women. And you have this chart in your books, and you can kind of see again, it just gives you a more technical aspect. So BMIs above 27 are associated, not indicative, but associated with increased incidence of your standard diabetes, coronary heart disease, hypertension, high blood pressure type aspects. It is horrible assessment for differentiating between fat-free mass and fat mass. And in fact, if you were an athlete at any time in your high school career or college career, you're probably going to be overestimated into obesity. Now, unfortunately, most of the United States is sedentary, and not sedentary in terms of they don't get up and get active. But what we were talking about in one of our lectures before, that participating in actually high intensity exercise that would force the body to add more lean body mass. Only about 3% of the US population. And that's an older number, so it fluctuates between 2% and 6%, but not a lot, right? There's more people that don't work out than there are people are work out. And so for the vast majority of people, it's used by doctors and researchers because it's pretty good at kind of telling how fat someone is, because they're assuming that you don't have a lot of lean body mass. If you have more muscle, you're going to tend to be overestimated in the obesity. So if you just, give you a second to kind of look at yourself, look at your height on the left there, and then look at your right at the top, and then just kind of see where those numbers intersect. And I'm sure because you guys are an active population and because most of you are athletic, I wouldn't be surprised if most of you are towards that obese and that tan or pink range, and not because you're a fat hog, but because you are fit. You have a decent amount of muscle tissue, right? Now, I'm not saying that we don't have excess body fat, but I would doubt that anyone is considered like obese and in a unhealthy aspect. I would argue that you have a significant amount of muscle mass as well. Now, it, like all their fitness principles, follows the Goldilocks principle. You can see on the right-hand side that when you increase in BMI, you have increased mortality from all other causes. So that's why the hypertension, coronary artery disease. But you'll see that when you go to the left, if you start to lose too much weight, you also have increased mortality. So this 25 plus or minus 5, so like 20 to 30 range is really your sweet spot. Like 27 starts to get that peak. So I would say 25, 20, in that range, that's where you're at. So again, Goldilocks principle, not too lean, not too much. But again, if you focus on awesome metabolism, good insulin sensitivity, and decent amount of lean body mass, you'll be kicking butt for a while. Okay, so height and weight are linear measurements, and now we're going to start talking about these circumferential measurements when we look at what the tape measures. And what we're doing is we're taking a flexible measure, and we're looking to get girth measurements around different segments of the body. And we're taking things within the appendicular skeleton, so the arms and legs, and we're doing things within the torso as well. Now, the problem is that just like with the scale weight, it does not differentiate between lean body mass and fat mass. But these circumference measurements are useful for change over time, and they can be a really effective measure of fat distribution. So the way this works is when we look at the torso, the midsection within the human body, so below the nipple line and above the waist there's not that much tendency for muscle growth. These muscles of the abdominal wall are flat sheets of muscle that cover a large area. And this is only about 1 or 2 inches that separate your guts from your skin. And you can kind of see the layers that are there. And you can see a little bit layer of fat right here, right under the skin, the fat. Then you have your abdominal wall. So you have like 3 or 4 abdominal muscles, maybe here with the rectus abdominis. And then you would hit another level of like fascia, the periosteum, and then the guts, your viscera. And so it's not much. And so when we look at changes, here's another view of that. You can kind of see, here's your viscera, the abdominal cavity there, and then that's it, like 2 inches from there. And again, here's your fat cells, here's your muscle. This muscle does not lend itself to a lot of growth, right? Here's your external oblique, your internal oblique, your transverse abdominis, rectus abdominis. There's that middle, that line right in the middle, that linea alba. In this section here, this is where your intestines would be, and there's your skin. And so any changes to this region is unlikely due to muscle growth. So when we take a circumferential measurement around the midsection, like we see in this image here, any changes, decreased or increased, are likely due to changes in adipose tissue, not muscle tissue. And so what ends up happening is we get this relationship in the midsection between what's called subcutaneous fat. Remember, that's the fat that's underneath the skin, and all mammals, we have it all over our bodies. And that is the fat that tends to increase and decrease with your amount of storage. So everybody right now has a six-pack that looks just like this, right? Everyone has tight abs and nice sculpted arms. It's just that you have a layer of fat over that. You don't usually find fat in the body cavity a lot, and you don't find it in the muscle. It's always underneath the skin, between the skin and the muscle in that subcutaneous layer. However, with increased, we talked about how the intramuscular fat is a tendency to have increased from poor metabolic aspect. Same thing with the visceral fat. You can start getting fat not under the skin, but actually in the body cavity. And so when we look here, the same aspect of the 190 versus 190, let's do another one where you haven't seen this image already. So 5'11" and 220 pounds. What does that person look like? Okay, now what if I throw this in there and say this person has a 33-inch waist? Now you can start visualizing a little bit more what this person looks like, not because of the height weight, because the BMI didn't tell you anything, but now because of what pant size or waist size they wear. And then if they have a 48-inch waist, now you can get a better idea based on what this person looks like. Yes, it doesn't differentiate between fat mass and muscle mass, but the circumference measurement, particularly through the midsection, can give you an idea of what someone might look like because of this distribution. So if you have two individuals, 5'11", and in this case, this image is showing 220 pounds, I can't tell you anything. I might not even know their body composition. Now, if you tell me 5% body fat versus 30% body fat, I'll know what they look like. A 5% body fat, we've already seen pictures of that, and we've seen 30% body fat. But if you give me that waist measurement of 33 inches versus 48 inches, I can also get an idea of what this person looks like, right? And so that's why circumference measurements are pretty helpful. There's two ways of doing it. We can do a waist to hip ratio, which is basically looking at the ratio between your hip girth and your waist girth, which requires then a straight up waist circumference. And the waist to hip ratio is kind of losing favor because there's some inconsistencies, but the waist circumference is that. So what's nice with the waist circumference is that it can capture, now it can't tell you what's visceral or what's subcutaneous, but if you have a thinner waist, you likely don't have either visceral or subcutaneous fat in that abdominal area. And if you have a thicker waist, it's not because of muscle. It could be because of some kind of abdominal tumor or a huge amount of gas or bloat. But for the most part, it's related to excess fat storage, whether under the muscle or over the muscle. And you can kind of see this cross sections here. I think the images there showed. Now, there's this concept of having a pot belly over beer belly. And if you touch this guy's stomach, it might be pretty firm. And that's because he has subcutaneous fat and he has visceral fat. Now, the fact that we cannot see his six pack means that he also has subcutaneous fat. This next image shows, see that apron hanging down over the belt line? That clearly is subcutaneous fat, but it's probably a combination of subcutaneous fat and visceral fat. And you could have guys that look relatively lean, right? Again, smooth out, no subcutaneous fat, but I wouldn't call him big by any means, but he's got that little bit of bulge because of that visceral fat. Now, all three images here showed beer, and the beer belly is not an inappropriate name for this. This type of visceral fat is usually stored because of really poor insulin sensitivity or poor metabolism, and alcohol kills sugar fat burning and puts you in storage mode almost immediately. So this is what we're supposed to look like, right? This is whatever, if you were to do a direct body fat assessment and have all the fat stripped off your body, that's what you would see. And some athletes are able to get down to that, where it looks like the skin is painted right on the body. So these circumference measurements definitely are associated. I would actually go as far to argue that waist measurement is more indicative than BMI. If someone had a BMI of 30, but they had a waist measurement of, let's say, 37 inches, I think they're fine, right? And if you had someone that was BMI of 27, but they had a waist measurement of like 38 or 40 inches, man, they lost a lot of muscle and they're all beer belly, right? And so that's what these numbers are. So you look at your chart, look at your book and see this. How do we measure this, right? And like we said, we use a tape measure, but the most important aspect is where do you measure? Because where you measure is up for debate. And if you look at 3 or 4 different organizations, all 3 images here, same guy, same tape measure, but image A, B, and C, that's all considered waist measurements, but they're all different spots. There is no consensus for waist measurement, and this is why it can be a little confusing. There's 4 different organizations like World Health Organization, ACSM, some of the other ones. We in the fitness industry are going to go with the ACSM standard. Just to keep in mind that if you look at the skeleton here on the left, there are 4 areas of potential measurement for the waist measurement. You have the iliac crest, and I'm going to go one slide here, and you can see this is your pelvis, this is your ilium, and that's the iliac crest. And then this is the lower rib right down here. And so these are your bony landmarks. This is your xiphoid process, so your sternum, your breastbone. Here's your floating ribs, or I'm sorry, your false ribs here. And that lowest rib right there is the one part of the landmark to measure the waist. So you're never measuring on the rib, it's always the soft tissue. And you're never measuring on the pelvis, it's this soft tissue area in between these 2 points here. So you can either measure right there and the right underneath that inferior aspect of the ribs, and you look for the thinnest part and you measure there, or you find the midline between these 2 points and you measure there, or the ACSM standard, the one that we do in class, we find the crest of the ilium and we go right above that and do the measurement there. I'll be honest with you, the one I do, because it's easy and it's consistent and it rarely never changes on a morbidly obese, they might, but right here at the belly button, I think is just the easiest because I don't have to palpate and mess around. And you can also, tape measures are cheap. They're like $1, maybe $2, and you can give them to your clients and they can measure. And then for them, instead of them trying to palpate and mess around there, they can look in the mirror, look at where their belly button's at, and bang, find it. So I actually find from a practicality perspective that the umbilical or the belly button is the easier measurement to do. Don't cheat and just do the umbilical. Why don't get your hands on people and learn how to do this in case you are working in a clinic or you're doing some kind of specialty exercise physiology aspect or some data collection and you need that. So that's looking at the torso and the appendicular the exoskeleton. We can also take measurements through the appendicular skeleton as well, through the arm and the leg. Remember, you'll see in this image all measurements are done on the right side. So unlike cardiovascular assessment or vitals, it didn't matter if you're left or right. For anthropometrics and body composition, all your measurements are always done on the right side. Just for consistency. It's not the right side is there or that. It's just when you're making serial comparisons from week to week or month to month or year to year, you don't want to take in account for any kind of asymmetry that exists. So if you go to the EXRX website, shows you all the protocols and where to put the tape measures, but you can kind of see here how the tape measures are operating. You notice here that the fingers are out of the way, that the tape is pulled relatively tight but not squeezing, and these are the torso measurements. So what we're going to do for our first lab next week is we're going to do height weight calculations for BMI. We're going to find the waist circumference based on some of the procedures. We'll do the waist to hip ratio, and we'll take the circumference measurements of the arms and legs.